hosts, Great Day Houston. And now, here's your host, Deborah Duncan.
Good morning, everybody, and welcome to Great Day Houston. We're starting off today's show with that little three-letter word, sex. So if you have young children, time to send them to the room and pull out the box set of Thomas the Train. We'll give you a few seconds to do that. Okay, hopefully you're back now. When you're dating, sex can happen any second. When you're married with children, you might have scheduled times. Tonight's the night. But what happens when it keeps getting pushed off to maybe the next night or the night after or the next week? If both parties are in agreement, does that really mean something is wrong? Well, let's ask the sex therapist. And here to share the 5 things you need to learn from a sex therapist, please welcome our resident certified sex therapist and relationship counselor, Emily Diala. And if you happen to have a question for our therapist, give us a call at 713-284-1055, 713-284-1055. Good morning.
Good morning. Thank you.
Okay, so I'm going to start with what I just did the introduction on, is that when we're dating, certain things happen frequently, more frequently, and there's this myth that after marriage, it all will halt. That's a myth.
It is a myth.
But it doesn't mean that you're always going to be on the same plane at the same time or capturing that same feeling you had in the beginning.
That's true. And actually, on average, couples who are married have sex more frequently than people who are single or who are dating. So that is one major misconception. But there's nothing wrong with planning sex. A lot of people have this, really negative associations with that word scheduling. But I remind people that in a lot of ways, it's kind of like dating. You know, if you knew Friday night you were going to be with your partner, you were getting excited, you were grooming, you were thinking about it, you were anticipating.
A little extra deodorant, a little extra spritz of perfume.
Exactly. So by the time that Friday night rolls around, you're so excited. So why doesn't that have to apply in a married relationship?
Yeah, absolutely. Okay, so there are 5 things you need to know about sex.
Yes.
First off, and this is, I think, where we have some great failings as human beings, especially in this country.
Right.
Own your own sexuality. What do you mean by own it?
It's so important. It's really, if you don't know your own sexuality, how can you expect to share it with another person? Think about, how can you turn yourself on? A lot of times people rely way too much on their partner when there's a lot that we can do individually to get things going. Whether that's fantasizing, reading erotic literature, and also it's so important to get to know your own body.
Yeah.
If you don't know what feels good for yourself, how are you going to be able to teach your partner?
But we have to get across some things like religion, for example. I think you look at the Bible or any one of those books and you procreate. You are made to do that. However, a lot of us have kind of these deep-seated lessons in our head that we shouldn't do these things, and it is a part of life. So we have to get past that.
Right. I always say, especially for women who maybe hold those kinds of religious beliefs, women have a part of the body that men don't have, whose sole purpose is for sexual pleasure. It serves no other function. So get to know it.
Yeah.
It's your clitoris, by the way.
Yeah, she's talking about that. Okay. How's that Thomas the Train video going on in the other room? The truth about sex, because a lot of us, I know there's always these fights when it comes down to the school having a sex education program, and parents who say, no, that's not your role, that is our role to do. But then when you ask adults, how many of you did your parents tell you about sex? Very few hands go up.
Right.
And then how many of you it was an older sister or brother or a friend?
Right.
And so when you're relying on that, oftentimes that information might not be correct.
A lot of times it isn't, and now it's getting even worse because the conversations aren't happening at home. So where do kids and teenagers go is the internet. And a lot of people are learning about sex through pornography. And the fact is, what people see in porn is not what's typically happening in most bedrooms. I mean, those are actors, medicated, it is scripted. I mean, the shots are in such a way, or the positions are in such a way for the best camera angle, which doesn't necessarily mean that it feels good. And so people have expectations, and it translates into a sex life that leaves people feeling dissatisfied a lot of the time.
Right. And another part of that truth about sex is just kind of the stamina, or how long it takes for a partner to arrive at the occasion, if you will.
Right. So I always, remind people, on average, most men only last between 2 and 10 minutes before reaching an orgasm or ejaculation. Women tend to take a little bit longer. But again, you see things on TV or in pornography that paints a very different picture. People come in with completely unrealistic unrealistic expectations about the way their bodies are supposed to function.
Right.
That creates anxiety, which can lead to problems in the bedroom.
And is it true that for women, a lot of it's up here first in our head, right? And so
Right.
that's why the foreplay is so important.
Very important. I always tell people the largest sex organ is your brain. So the more that you can do to get your brain in gear, the better everything else will go.
Okay. Number 3, sex shouldn't hurt.
Right.
We read 50 Shades of Grey, and there was some pain involved there.
Sex shouldn't hurt unless you want it to. But yes.
Okay, no, wait. All right. So, okay, sex shouldn't hurt. Then we'll get to the unless you want it to part.
Okay, so number 1, yes, sex should not be painful. But unfortunately, a lot of women do suffer from different kinds of sexual pain issues. A very common one is called vaginismus. It's basically where the outer third barrel of the vagina or the pelvic floor muscles kind of involuntarily spasm such that anything that goes inside can be very painful. Yeah. And that is there's a lot of treatment options now, and they're relatively new. 10, 15 years ago, a lot of doctors would just say, have a glass of wine and relax.
Yeah.
Well, it's not that easy. There's other kind of pain issues that women can suffer from, so it's really important to talk to your doctor. Still, a lot of even OBGYNs don't have much information about these. They actually call me in to educate the residents.
Right. Of course, your dad was an OBGYN.
Yeah,
so
my dad is
an
OBGYN, so I'm pretty well informed. But it is kind of a relatively new way that we're treating these, but it shouldn't be painful.
In fact, there are more and more hospitals that have pelvic health, just kind of another study of medicine, pelvic health specifically.
It's becoming very popular, and it's a kind of a comprehensive treatment to different kinds of pelvic pain disorders.
Yeah. And that'd be relief to a lot of women, because I would imagine that they're thinking, something's wrong with me. I have to grin and bear it because obviously this is a normal thing that I should be able to do, and I can't. And so they feel ashamed, and they might not go.
They may not, but it's really important to be open with your doctor, and if you feel like your doctor is kind of brushing you off, which I still hear all the time, keep looking around or call a therapist, like myself, who kind of knows where to, send you. Yeah. Even physical therapy is a great tool for treating different kinds of pelvic pain. So there's a lot of good treatment options. It's important to educate yourself.
And number 4 is don't learn from porn. You touched on that. And then the other is probably the most important, especially after you're married, I think, is play.
Play, have fun. I think even sex toys are called toys for a reason. There's nothing wrong with enjoying yourself. I think it's an adult form of play. I think your sexuality is a wonderful way of expressing yourself. It's a way to experiment with different roles, with different parts of your psyche. And if you have a partner who is open to that, there's a lot of things you can do.
All right, so I'm going to back up to when it says didn't hurt. In 50 Shades, it touched on something that was kind of crazy for a lot of people. And it was considered playing, but at the same time, there was some pain involved. So tell us how couples negotiate that.
To compare it to kids who are outside playing, they may be playing, tag, they fall over, that hurts a little bit. It doesn't stop them from, getting back up and enjoying themselves. They're still having fun. And it's not like you have to do the 50 Shades of Grey type of stuff to have great sex. There's tons of stuff that you together as a couple, and all kinds of different play.
Yeah, you don't have to dedicate a whole room.
You don't have to dedicate a whole room. Just a little toy box.
And those who are laughing have read the book. Those who are not don't know what we're talking about. All right, the movie's come. Yeah. Okay, let's go to Angie on the phone. Good morning, Angie. Angie, can you hear us?
Yes, I'm here.
Good morning. What's your question?
My husband's had problems with low T, and that gave him negative effects, and he would continue to try to perform, and it gave him a curvature. And we've tried the different pills and different things, and I think it's mainly stress from his job, because I know that if we go drink, it kind of takes him out of his head a little bit, and then things seem to work out better. But I don't want to continue to have drunken sex for the rest of my life.
Don't want to continue to
have drunken sex for the rest of her life. That's where maybe some therapy could come in to play here as well.
For sure. I always tell people, couples who feel like maybe alcohol helps, that tells me that alcohol is lowering an inhibition that may be there. And so you want to find out what kind of blocks you're having that you can't do that naturally. And in fact, too much alcohol can have negative effects sexually, so that's something to keep in mind too. But this low testosterone is bad right in the medical community. I have very young guys in their early, who are, being referred by their urologist to me because they've gone in because they think they have low testosterone.
Well, with that said, it is true, especially with aging, that low T can happen. But you're right, as oftentimes happens, people start to rely on something. Oh, that must be it.
Exactly.
And think it's the answer for everything.
Right.
If you have low T, that's one thing, but if you don't, you shouldn't be taking
You
those
shouldn't. You want to
hormones.
be really careful. And there's a lot of lifestyle changes that you can make to help with that. Exercise is so important. Every study they've done looking at the effects of exercise on sexuality is usually a positive correlation because exercise helps promote blood flow. It makes you feel good about yourself. You're doing something good for your body, and so that can then translate into the bedroom.
Yeah. She also said we're using the pills and everything too.
Right.
I'm probably talking about Cialis and things like that.
Right.
But again, you have to figure out where is the hesitancy or the problem coming from
Exactly.
before you try to address it.
And a lot of times those medications like Viagra and Cialis are ineffective if the problem is purely psychological. They just don't work.
All right. Well, Emily's staying right here to take your calls. If you have a question for our certified sex therapist, call us 1-3-284-1055, and we'll try to answer your question on the air next.